the cow eye dissection. So what I'm going to do is I'm going to cut some of the fat and muscle around the eye area. So I'm going to use the scalpel, and I am going to make an incision. I'll turn it this way. Make an incision right here, just under where the cornea is, and push. This liquid that's coming out is the aqueous humor, and it's what maintains the shape of the eye. Okay. Now that I've made this incision, I'm going to gently go around the eye. Okay, so now we've got it like this. There we go. So the liquid is aqueous humor. The jelly-like substance inside is called vitreous humor. Okay, so I'm getting rid of the vitreous humor now. So this cream-colored outer layer right here, that is actually the retina. Now we're going to remove the retina, and in one part of the eye, it's fairly difficult to remove the retina, and that's because of the axons that are holding it there, the axons of the nerves. It's stuck right there. Where these axons pass through is actually called the optic disc, or the blind spot. You can't see it very well. Actually, you can. So in humans, they do not have this iridescent color right here, but animals that use it for night vision have it, and it's called the therapeutic, I believe is how you pronounce that. So the black part, so you have the iridescent, and then you have the black part right here, and that's called the choroid. Okay, so once you push back the choroid, let me do that. There we go. Okay, so that's pushed down now. And underneath of that is a thick white layer, which I will show you. So it's right here. This is called the sclera. Now on the anterior portion of the eye, I'm just removing some of the vitreous humor so we can see more clearly. There we go. That's good enough for me. Okay. Now this circular gumball structure, this is the lens of the eye. Now I don't know if you will be able to see it, but along here, the striated parts, this is called the ciliated body. This striated parts around the lens of the eye is called the ciliary body. I don't know if you can see that very well. Right there. Okay. So I'm going to slowly remove the lens. So now we're looking for suspensory ligaments. So remove some of this. And it is what is attaching the lens to the eye. It's the muscles right there. Now we're going to slowly remove that. There we go.
Responsible for allowing more or less light to enter the eye. During the day, you want less light, and at night, you want more light. So that iris is actually going to change shape, and it's going to allow this hole here, called the pupil, to become larger or smaller. That hole in the iris is referred to as the pupil. How?
This hole within the iris is called the pupil. So right in between there. So the hole itself is called the iris, but through the hole, right in here, this is called the cornea. This is the olfactory nerve. This is the optic nerve. It's been cut off right here. This is the optic chiasm right here. And the optic nerve was right here. This is the cerebellum. This is the cerebellum. This is the cerebrum. These are the frontal lobes. This is the parietal lobe. This is the temporal lobe. Oops. And this is the occipital lobe, right in the back. This is the sagittal suture, right here. This is the transverse suture. Actually, the transverse fissure. So I'm going to separate the right and the left hemisphere of the brains, or of the brain. I'm just gonna cut so it makes it a little bit easier. A little bit more. There's white tissue deep down that's holding it together right there. That's the corpus callosum. Here's a better look at the corpus callosum. It's right here. The thalamus is here. Optic chiasm is right here. Let's see. So the optic chiasm is right here. Here's the mammillary body. Pons is in this region right here. Medulla oblongata is right here. Cerebellum is right here. Here are the tissues of the arbenente. I'm going to make a frontal dissection. So just cut through the front part of the brain. So once I did a frontal dissection, you can clearly see the white matter of the brain versus the gray matter of the brain. Here is the lateral ventricle. Okay, so right here we have the spinal cord, we have the medulla, pons, the midbrain, the pituitary gland, the optic chiasm, and the corpus callosum is right here. So these tops are gyri, and in between these are sulci.